Merger goes forward, the combined company will administer 1.14 billion prescriptions annually and would handle 41% of all prescriptions administered by PBMs. It would be nearly 2 times larger than its nearest competitor, CVS Caremark. Over the past decade, PBMs have become major players in the healthcare industry. By one estimate, 90% of individuals with prescription drug coverage receive benefits through a PBM, and PBMs handle approximately 2/3 of all prescriptions written in our country. PBMs serve as middlemen between drug manufacturers, pharmacies, and health plan sponsors. PBMs do everything from negotiating the prices health plan sponsors pay for drugs to setting the prices pharmacies are reimbursed for dispensing drugs. They also decide which specific drugs make it onto formularies eligible for reimbursement. In addition to all of these functions, Express Scripts and Medco would control about a 60% share of the mail-order pharmacy business, which ships drugs in bulk directly to consumers. Finally, these two PBMs operate, quote, specialty pharmacies, pharmacies that carry drugs used for the treatment of the most rare and challenging ailments. They would together control over 50% of the specialty market after the merger. In this regard, it is notable that no large employer who privately expressed concerns to us wished to testify at today's hearings, often telling us that they feared retaliation from the large PBMs with whom they must do business. We are also aware of the concerns expressed by pharmacies, both large chain drugstores and small community pharmacists, of what they believe are likely harmful effects of this deal. Pharmacists believe that the PBMs will force consumers to use mail-order services and squeeze the reimbursement rates pharmacies receive from PBMs. There is no question that this merger will have far-reaching and long-lasting effects on the way prescription drugs are paid for, sold, and dispensed. So the burden will be squarely on Express Scripts and Medco to convince us that this merger will not unduly harm competition, but in fact will benefit the millions of consumers who continue to face rising prescription drug costs.
And while this primary question that we are examining is the effect that this merger will have on competition, I can't ignore the potential effect, obviously, that it would have on the quality of health and health care that Minnesotans receive. I am particularly concerned that this type of consolidation will leave very few options for large employers who often rely on the big three PBMs to manage and administer their complex prescription drug plans. The Fortune 50 and Fortune 100 firms cover millions of Americans. If this merger will ultimately mean less choice for those companies, that is something we need to be concerned about. And it's something that I hope the FTC is closely examining, and in fact that I'm quite certain they are.
Obviously, this industry is among the most lucrative in the country. It's increasingly profitable. The question is, how will consumers be protected from overreaching and excessive profits that are at the expense of competition? One issue is whether consumers will be driven to mail-order services, as has happened, for example, in Connecticut. That's a big concern, not only to the pharmacies that may be affected, but also to consumers who may have choices constricted. And ultimately, competition is about choices, and the impact of this proposal on choices for consumers will be very, very important.
This would be a merger of two of the big three PBMs. If approved, nearly 135 million Americans would rely on this mega PBM to manage their prescription benefits. It would control over 40% of the national prescription volume, 60% of the mail-order pharmacy market, and an excessive amount of the specialty pharmacy market. Patients in particular would be harmed. They will experience reduced or no choice of their pharmacy providers. More consumers would be forced into using the PBMs' own mail-order facilities. They will see decreased or limited access to essential pharmacy service. They will experience separation of their prescription medication records that could result in potential adverse patient health outcomes. They will encounter disruption to normal, timely prescription service, and as a result could potentially suffer decreased medication adherence. Reducing patient choice and access will lead to higher prescription drug costs, potential adverse patient outcomes, and higher downstream health care costs.
Giving them more clout will enable them to keep even more pharmacies out of the market. Why is that a difference? Because as far as we know, there isn't a consumer who would prefer to deal with a 1-800 number or a robot instead of Ms. Sutter. The law is clear. In a merger that significantly increases concentration, they must prove extraordinary efficiencies. 13 years ago, 4 drug wholesalers tried to merge, and they had the same efficiency arguments that these folks have. And the court rejected those claims for 2 reasons. First, with only 2 people left in the market, there was no guarantee those efficiencies would be passed on in lower prices to consumers. Second, competition was a better way for those efficiencies to come about. This is what Judge Sporkin said. The history of the industry over the past 10 years demonstrates the power of competition to lower cost structures and garner efficiencies as well. It's competition that makes this market work, and we shouldn't allow these 2 firms to extinguish that competition. The law is clear. In a merger that significantly increases concentration, they must prove extraordinary efficiencies. 13 years ago, 4 drug wholesalers tried to merge, and they had the same efficiency arguments that these folks have. And the court rejected those claims for 2 reasons. First, with only 2 people left in the market, there was no guarantee those efficiencies would be passed on in lower prices to consumers. Second, competition was a better way for those efficiencies to come about. This is what Judge Sporkin said. The history of the industry over the past 10 years demonstrates the power of competition to lower cost structures and garner efficiencies as well. It's competition that makes this market work, and we shouldn't allow these 2 firms to extinguish that competition.
But I heard you say just now that significantly increasing discounts over what you're getting right now is really not why you're doing this deal, and you're not nearly as certain as some people might think that this deal will result in far more discounts from your suppliers. There are other ways in which you hope this deal will pay off.
That is correct.
Okay.
I can't stop certain pharmacies from going out of business. When there's 10,000 McDonald's in the United States, roughly, there's roughly 13,000 Starbucks in the United States. There's 68,000 pharmacies in the United States. There's a lot.
It seems like we've totally ignored the fact that these entities can have pharmacies that are in direct competition to me. I'm their competitor, and they set my rates. And that's what I would like the FTC, or at least Congress, to look into. Why?
One of the main arguments, Mr. Paz, for the merger is that combined you'll be able to develop more innovation and new clinical tools and strategies for cutting costs. And yet, we all know that innovation is the fruit of competition, that the more competitors, the more innovation, the better the consumer served. You seem to be making an argument to the contrary. And you come up with a new concept for how capitalism works?
Yes. Well, you look at United Healthcare entering into this market in a very big way, Cigna coming into our space in a very big way, Prime Therapeutics coming in a very big way. Innovation is key. We know our role. Our role is to drive down the cost of health care and improve health outcomes for the millions of Americans we service. We have to remain innovative. We have to continue to go to the market. Plan sponsors like Mr. Streeter have many, many options. The day we start falling behind in innovation is the day our market share will decline. We must stay focused on improving health care.
But competition is what breeds all of that urgency and activity. Would you suggest that if you could also take over Caremark and CVS, that would be the best thing for everybody? Or you control the whole market? Would you then innovate in a way that would not be possible otherwise?
Can I go back to the conflict of interest issue in the specialty pharmacy area? Because I think it illustrates the problem here. Because Mr. Paz owns if he just owned a specialty pharmacy, fine, let's compete on the merits. But when he owns a PBM, he knows everything about his competitors. When his competitors get too large, he excludes them from the network. When his competitors get certain customers, he can focus and target those customers. It's those conflicting interests that create a tremendous problem here. And the merger makes it worse by combining his market clout with a dominant position in specialty pharmacy.
I'm told that Senator Klobuchar mentioned this earlier, that over the past couple of years, 12 communities in Minnesota have lost their only outpatient pharmacy. And this is a huge loss for residents in those communities, especially because Minnesota winters are kind of rough, as you know. When elderly patients have to drive many miles in the dead of winter or have someone drive them to pick up their drugs, I worry. There are currently 141 rural communities in Minnesota that have only one pharmacy. Medicare Part D only requires that 70% of Medicare beneficiaries in rural areas have access to a pharmacy within 15 miles. That means that 30% of beneficiaries could live more than 15 miles from their nearest pharmacy, and as I understand it, there is no upper limit. So that means someone could drive conceivably 80, 90 miles for a pharmacy. Don't you agree this is a serious problem for health care in our country and in Minnesota?
Rural pharmacies, Senator, are a very important part of our network. It's not only governed by CMS. CMS clearly sets standards. DOD also sets standards that we have to adhere to on behalf of our men and women in uniform and their beneficiaries. But our plan sponsors, just as importantly, set standards as well.